Are you sure you know the differences between LPNs and RNs? If you would like to know, stick around to the end. Hi guys, welcome back to my channel. My name is Barbara, and on this channel we talk about how to study in Canada, education process in Canada, basically the steps and procedure, pretty much everything you need to know about how the educational system works in Canada. So if you're someone who is interested in this kind of content, definitely stick around, subscribe, turn on the post notifications so you don't miss a thing. Okay, now let's get right into the video. So this video is actually for you out there who would like to go to nursing school but are very confused in what level of nursing to take. If you are really interested, stick around. I'm going to explain all there is, the tea, everything that you need to know about nursing. So there are actually 5 types of nursing in Canada, at least that's what I know. We have the HCA, the healthcare aide, which is 6 months of education. We have the LPN, licensed practical nurse, which is 2 years of education. We have the RN, registered nurses, which is obviously the 4 years, the most popular one. And we have NP, nurse practitioner. That's the highest level of nursing. That's the bosses of all nurses. Okay, so if you would like to take your master's degree in nursing, that is where you have to go. That's actually 2 years of obviously education, but you need to be actually have your 4 years bachelor's before you can actually qualify to be in the master's, obviously. And but today I'm actually going to talk about only 2 types of nursing, the most popular, the most common ones that we actually know, which is the LPN and the RN. Compare both and actually make you decide which one you think will be the best for you, or which one you think you would like to go for. So I'm going to start with the LPN. I'm going to start with pros of being an LPN and then cons of being an LPN. What is an LPN? LPN is licensed practical nurses, and they are normally nursing assistants, and it's 2 years of education, but basically we do pretty much same thing, a little slight difference. You will know this. It's a little slight difference between the LPN and RN, but we both work hand in hand. We work bedside, home care, whatever. We can work pretty much everywhere. People really don't consider that as nursing, but we are nurses. We take care of clients. We do pretty much everything. Okay, we can work in hospitals, whatever. So the doctors, if there is no RNs, we are in charge. So yeah, you better respect the LPN. So now let's get to the pros of being an LPN. So number 1 will be the 2 years. Obviously it's short, it's quick, it's fast. The LPN is easy to get in, and the requirement, you only need 3 courses in order to be accepted in the LPN course in Canada, which is the courses is English, math, and biology. It's obviously not competitive, and the fees are less than the RN, obviously, since it's 2 years. The fees are always going to be less. And once you are done with school, you can work in clinics, you can work with private agencies, you can work in hospitals, home care agencies, pretty much anywhere. Yeah, that's basically it for the pros. That's all I can think of for the pros. Now let's get to the cons. Okay, so number 1 con is, remember I said it's 2 years, it's fast, it's quick, whatever. It's the most stressful 2 years you could ever endure. I'm not even trying to exaggerate. It's the 4 years, but everything in 2 years. So you can imagine how stressful it can be. So if you're someone who takes your mental health very seriously, this is not the one for you. It's very stressful, because every day there's clinicals, there's assignments, there is this, there's that, there is exams. All the time you are doing something. There is never a free time, unless it's vacation or holiday or whatever. Even during that, you still have some assignment which is due. So there is never there's always something. Okay, there's always something, because it's a fast-paced course. There's always something going on. Okay, you are always busy. You don't even have time for your friends. That kind of busy. Yeah. Another con is we only do 3 kinds of clinicals, which is not fun. We do all the theories: mental health, maternity, peds, medicine, surgery. Yeah, that's all, right? That's the basic ones that we do in nursing school. yeah, we do all of that. But when it comes to the clinicals, practical, we only do medicine, surgery, and home care. That's pretty much it. It's not fair. It's not fair. Like, we need to do all of that. Because of our limited access to clinicals, we cannot work in certain areas as soon as we're done with school, obviously, which is maternity, pediatrics, operation rooms, mental health. In order to be able to work in these areas, you have to take extra courses when you're done with school. So we can still work in those areas, but you have to take extra courses. And also, we have limited access to skills. Like, when I say skills, I mean like what we can actually do on the floor. We can give medication, we can give injections, catheter, immunization. We can actually do a lot, but there are certain things that when you're doing, you need like an RN with you. Like, you need like a supervisor or like supervision to do it. But now they keep on increasing our scopes, which is very good, because we are basically like head to head with the RNs now. But the only thing is the blood product. Can you imagine? So we get the blood, we identify the clients, we do the checks, everything, we hang it, but guess what? We can spike it. But we will obviously be checking on the clients like every 15 minutes, every 30 minutes. We are going to be doing the vitals and everything. And now moving on, now let's get to the pay. The pay is chicken change. It's really less pay. So if you are someone who is really after like the big checks, please then go for your RN, okay? Because the pay is, it all depends on your experience. That's when you actually feel it. But now as a new nurse, yeah, the pay is like, especially when you're working with like agencies, like private agencies, oh, it's even less. So yeah, and that's another con. And also, like, when I finished school, it was very hard for me to find a job. Very hard to find a job as an LPN compared to RN, unless I wanted to move to like a rural places, like, you know, little towns. That's when you can actually get a job, and that's where you can actually get a full-time job. But if you live in a big city, please, full-time, part-time, forget it. You're only gonna get casual jobs, casual shifts and all that. So I have like 3 jobs. I have 3 casual jobs. I jump from here to here to here all the time. Like, it's crazy. But yeah, I'm having fun. It's fun. It's alright. I'm getting my experience, but I still want more. Obviously, nobody is ever satisfied with wherever they are. I still want more. I still want to go higher. I still want to go forward with my education. And speaking of education, when you want to further your education to become an RN, they've made it really impossible. I'm talking about Canada. Like, I don't know for the US or whatever. I'm talking about like where I am. They've made it really hard and impossible to actually go and get your RN, like bridge and get your RN. Since we did 2 years, wouldn't it be fair to like do another 2 years and then boom, 4 years we done, right? No, these people, they made it 3 to 4 years online, not even in class, online studies. So this means that if you're someone who cannot do online, if you are like you're like a lazy person like I am, then online studies is not for you. All the theories are going to be online, but the clinicals and everything will be like obviously in person. You have to go and then do it. And another con I would say is we can't really take leadership roles. The only time we take leadership roles is when we are working in the home care facilities. That's when that is when we are in charge of the HCAs. So we like deliberate roles and then give them assignments. Basically we are in charge. But if we are working in a hospital, or if you're working with an RN, obviously the RN is like above you. So yeah, basically the pros and cons of being an LPN. So if you are still, listen, it's such a great course. It's really good. You get all your skills. The only, I would say the only thing about being an LPN is the less pay, and then the fact that people actually do not like consider us as nurses, which is very disrespectful, because we go through the same stress and same anxiety and whatever. Like, we pretty much do the same thing in school, same books, same clinicals, same I don't know for the exams obviously, but like it's like very similar, you know, very similar. So for us to be able to be like, oh, I want to go back to school, get my RN, it shouldn't be that hard for us, you know. It shouldn't be that hard. It should be easy, so we can get it like fast and efficient, and then be able to help out, you know, like. Now let's talk about the RN, which is we're gonna do the pros and the cons for RN. They pay really good. They pay like that's the big check. So, and you get to do all the 5 clinicals, like the maternity. You get all the skills, you get all the experience, and you get to work in all these areas when you're done with school. I think the only one that you also have to take, I asked one of my friends, she said the only ones that you actually have to take extra courses is operation room, because it's obviously different from what they learn in school. So you have to like take extra courses to be like an all-round nurse, because it's easy to get a job as an RN. Once you're done and you apply to everywhere, you get the call, you get the job. It's easy. Okay, is it actually easy? It's not easy. I'm just exaggerating, but like compared to RN, sorry, but like compared to LPN, it's actually very easy to get a job. The RNs take leadership roles. They're in charge of the other nurses, the LPNs and the HCAs, the managers. Like, they pretty much deliberate all the rules that goes on, and they have access to all the skills. They can pretty much do all the skills, everything. They can do it. No extra courses to do this or that. Obviously, one more like very important pro is you get your degree. Like, you don't need to go for any extra education. All you have to do is get your master's. That's if you're interested, right? Like, it's easy for you to like get your master's compared to LPN. Now you have to be an RN, and then you have to do the NP. That's a long way to go. So it's easy to like move forward with your education, and basically that's it for the pros. Like, there's a lot of advantage being an RN compared to an LPN, and the cons of being an RN, I would say, is obviously it's longer. It's 4 years of education. It's longer. It's stressful. I'm not gonna say it's not stressful. It's very, nursing school is stressful. Even if it's 1 second, it is stressful. Okay, everyone suffered. If you went to nursing school and you didn't suffer, then your head is good. The clinicals can be very tough. It can be very challenging. So here you have all the tea or the gist about the LPN and the RN. So let me know down in the comment section. Let's interact in the comment section if you would like to go for, if you are actually thinking of going to nursing school, and which one would you like to go for, RN or LPN? Which one do you think will be best for you? It's all great courses. You are still considered as a nurse. You can still further your education with LPN. You can still further your education with RN. Don't give up. Like, just do more research, and pretty much, yeah. Or are you like done with your RN and would like to go for your master's? Leave it all down, and let's interact. Okay, so do check out my other videos. I have a video about nursing schools in Canada. You can check it out. If you have any suggestions for videos that you would like me to make, leave it down. So you've come to the end of the video. I hope this was helpful to you. I hope it was useful. I hope you actually got something from it. But did you subscribe though? Did you? Thank you. for subscribing. So subscribe, like, share to your friends, share to your family, share to your church members. Anyway, thank you for watching my video. I will see you in my next video. Bye.